I'm Sarah Zabel, independent candidate for U.S. Congress in Idaho's 1st District, and I want to talk to you about Medicaid expansion work requirements. This was part of the One Big Beautiful Bill Act, which all of our representatives voted for. So Medicare is the program for people 65 and older. Medicaid is the program for people below a certain income level. When Medicaid expanded in Idaho after the referendum in 2018, it included another 79,000 people who had not been eligible before. Now, among these were some who are able-bodied, but below a certain income level, but also veterans with 100% disability, pregnant women, people who are medically frail, like cancer patients, and other categories. Now, every category has to prove its eligibility every 6 months. For those who are able-bodied, they have to prove that they have been working or seeking work in those 6 months. So it sounds like a very reasonable requirement on the face of it, but experience that we've had in Arkansas and Georgia show that actually there's a lot of problems with it. It becomes a bad business decision and a bad economic decision. In Arkansas and Georgia both, what they saw was that the great majority of people who were excluded from Medicaid because they were not showing, proving that they were working or seeking work every 6 months, the great majority were actually still eligible. They just couldn't get through the bureaucratic hassles of proving that they were eligible. In Georgia also, we've seen exorbitant costs. So Georgia started in 2023, and they're still going with their implementation. So far, they've spent $85 million. $55 million of that was spent on IT systems. So when you port that to Idaho and you think, what will it cost to implement in Idaho a system to track and have people verify that they're meeting these work requirements? We don't know. When Idaho legislature passed the HB 913, which implements Medicaid work requirements, they didn't include any sort of cost estimate or any sort of savings estimate. In Georgia, what they're finding is that the benefit for a Medicaid beneficiary costs about $7,000 a year. The administrative costs for proving that they still qualify, that's another $9,000 a year. That's an exorbitant admin cost on top of the cost of the actual program. So bringing it to Idaho, the legislature passed HB 913. It's now sitting on the desk of Governor Little, waiting for him to either sign it, veto it, or let it become law without his signature. When Idaho rolled out Medicaid expansion after the 2018 referendum, it saw real cost savings. So when people are excluded from healthcare, from Medicaid or from insurance, it's not that they don't get sick. They do get sick, they go to the emergency room, and it becomes uncompensated care. So for 2 years after Medicaid expansion rolled out, for 2020 and 2021, the hospitals in Idaho reported that they saved more than $100 million that had been directed towards uncompensated care. So now, because of the One Big Beautiful Bill Act, because of Idaho's implementation of that act, we're looking at rolling back medical care, medical coverage for Idahoans who actually are still eligible for Medicaid, but are unable to prove it every 6 months. The estimates are that somewhere between 17,000 and 34,000 Idahoans will lose their health care coverage because of the work requirements. And again, not because they don't qualify, but because they can't prove that they qualify every 6 months. That, like I said, is a very dubious business decision. And especially when you consider that the Idaho legislature has not done any cost estimates for what does it cost to implement this program, and what do they think they're going to save out of it. They haven't done that math. They've just been nodding their heads to the directive coming down from the federal government. So what is it going to cost us to actually deprive people of their medical care? We don't know. Paid for by Zabel for Congress.